Before I would start, I would particularly like to thank Sambodh Research Foundation to invite me to talk about this very important issue. And I would particularly like to thank Professor Subhash Hira. I've known Dr. Hira for a very long time, since my college days. And in my opinion, Dr. Hira has done much more for the community in general and medical community in particular. And I really admire his work and I wish him all the best in his future endeavor. We are talking about a very important issue and quite dear to me. I've been a practicing psychiatrist here in Canada, but have worked in many different countries, including many different parts of Africa, Asia, in Europe, and Australia, New Zealand. And before we go any further, I think it's not all doom and gloom. It is important to realize that most of the people are actually quite resilient and will not succumb to psychopathology. I believe that some people actually will find new strength and even experience some sense of relief. I have my patients actually telling me that enough of running around and they would like to re-examine their lives. And I believe that society at large actually may also experience significant compassion or will come up with a lot of innovation. Look at this meeting today. We would not have been able to do anything like this before the pandemic. Because there is an urgency, a lot of new innovation is occurring. If you look at issues like climate change, people are becoming more hopeful now. There was a newspaper headline which says that the office is dead. I don't know whether that is true or not, but people have realized that there is no need to continue to work in an office setting because majority of the work can be done at home, and we might see actually less cars on the road. The in terms of lockdown effect per se, in many countries, the lockdown came very suddenly. So at that time, before the lockdown came in, I think people did notice, especially there were some newspapers which were making some headlines. There were some medical journals, they were printing some articles about what was happening in Wuhan, China. Before the actual lockdown came in, although there was some kind of rumblings, I know that there was a denial not only at an individual level, but even at an institutional level. I remember that I was talking to a couple of my colleagues, and in fact, they were thinking that this is just going to be a glorified flu because we had all gone through, especially in Canada, we had gone through that scare during the first SARS episode in 2003. And then the H1N1 flu came in. And at that time, somehow there was a magic bullet found. But unfortunately, this kind of denial did not serve the purpose in many countries. So what happened was that when the lockdown did occur, the reaction was similar to kind of a grief reaction, whereby there was complete shock and denial. People were becoming angry, and then slowly a bargaining kept in that no, they'll be okay. We'll be locked down only for a period of time, and everything will be okay after. When they realized that no, that was not going to happen, then slowly the despair and fear started to creep in. During the mid phase of the lockdown in many countries, slowly but surely there was a lukewarm acceptance. The acceptance was not complete acceptance, but people are thinking that, well, what choices do we have? Because we are all in the same boat, or we are all in the same storm, so to speak. But underlying the kind of resentment was kicking in. Now, people have started seeing the late effects of the lockdown, whereby we have seen hopelessness. There's some kind of lockdown fatigue that is happening, whereby people were saying that this is enough. And some people would start to break rules or regulations whereby they were not observing the social distance. And this is the period of the time whereby there has been observation of frank psychotic behavior or manic behaviors. People have become violent, and there is a more risk of substance abuse, especially people using more and more nicotine, alcohol, and other drugs. The unfortunate part of the lockdown is that there is a destruction of social fabric, whereby there is an inability for a group of people to attend important, significant events in their life, be it birthday parties, marriages, or even funerals. And that led to a lot of different behaviors by different group of people. And unfortunately, that also led to stigmatizing certain group of individuals. Sometimes we heard the reports of certain healthcare professionals being stigmatized. We know that there's some elderly population that is being stigmatized. In Western countries, there are Asian people who are being stigmatized. And unfortunately, the social media, the conspiracy theories, and the so-called paid pundits did not help the situation. Now, when I say post-lockdown, I think the lockdown is ending in different countries at a different pace. We also know that lockdown per se that is opening up now is not actually a medical necessity, it's an economic necessity. And unfortunately, individuals may show lasting effects of prolonged stress. And although I'm quite heartened by the presentation that Dr. Bassin had come up with, that there is some hope in terms of recovery, unfortunately, what is probably going to happen is that the financial virus, which has been circulating underneath the drama of this pandemic, there is a very good chance that generations to come may pay for it. And that may lead to a lot of unemployment, lot of economic hardships, and one would see lingering resentment and bitterness, which in turn will affect the productivity of our workers. And unfortunately, during the same time, we are likely to see more suicides. So I did say that this is not all doom and gloom, and many people are resilient. But we also need to realize that who are the people who will be most at risk in terms of developing all kind of mental health related problems. Well, one of the main group is healthcare providers. I say they are the main groups because unfortunately, we know from previous experience that healthcare providers are very good in giving very good advice to the population in general, but they have difficulty in following up their own advice. Majority of the research in the past has shown that healthcare providers are not good patients. There's a lot of stigma in terms of healthcare providers coming forward to seek mental health help. There's an embarrassment. And we know from the data that was presented to us previously, and we know from the previous emergencies, that a lot of suicides occur in healthcare providers. We have in fact seen some of the suicides occurring in US and even in China. And I do believe that there'll be increasing number of suicides in healthcare providers because at this particular time they are feeling lost. As a medical professional, the duty is that we would like to help people. Unfortunately, we are unable to help. There is no magic bullet. We really don't know what exactly is going to happen because there's a lot of uncertainty and moving parts. I also believe that people who have pre-existing mental health problems are the people who will be more at risk. People with multiple health problems. The other problem that in Western countries have is the nursing home residents, and especially in Ontario and Quebec in Canada, and in Seattle in US, we did see a number of cases occurring in nursing homes. And unfortunately, the relatives who lost their elderly relatives due to COVID were also at risk in terms of developing mental health problems. Newspaper Guardian had a wonderful article about 18 to 25 years age group, then developing later on mental health problems and lot of resentment because for them, this is their prime years. And people with disabilities, whether they are physical disability or intellectual disability, will be more at risk. It is unfortunate that even otherwise, there was a less and less spending in healthcare, more so in mental health. And unfortunately, we have not treated our brothers and sisters who suffer from disability. And I believe that these are the people who might suffer more during the post lockdown period. On 5th of May, Guardian ran an article about poverty kills. We know from experience that as we climb up in economic ladder, people's health actually improves. Even the current data has shown that the rate of death is more than double in people who are poor, especially people who are the lower socio-economic strata. So we now realize that this virus is a great equalizer. On one hand, there are a number of reasons, and my esteemed colleagues in economics and social work will be able to give you many different reasons why poverty kills. But we know that the equalizer virus will mean that we'll all be affected. So it will be important for different nations to really address the poverty and may even follow the examples of some of the other countries, including New Zealand or some provinces in Canada, to come up with a basic income support program. And it is important to address this poverty issue in the long run because it will affect all of us. We have identified some of the population. We have identified that these are the group of people who may be more at risk. So the idea is, what can we do? We know that there are some simple measures that one can take. One would like to establish and maintain routine. I actually tell my patients to make a schedule whereby they will follow each day to the point whereby they will decide what breakfast to cook, what lunch to have, what kind of social media they'll spend time on, what kind of news outlet they are going to see, and taking care of their basic needs in terms of sleep, food, hydration. We also advise people to maintain active lifestyle. I know that this is not easy in many countries, whereby the living space is small. Secondly, the lockdown is so strict that you are unable to go out. But fortunately, internet has provided us with lot of useful resources in terms of maintaining an active lifestyle. And one can do simple exercise routine. And I tell my patients to actually vary their routine and make the schedule in such a way to stick it on the fridge and follow that rigidly. And we have seen the benefits not only for the adults, but for the children as well, who not only are doing the online schooling, but at the same time following this schedule to keep them healthy. It is also important to realize that alcohol is not going to help, neither the nicotine or the substances. They may provide you temporary relief from anxiety, but in the end, it will create more problems. We also know about doing meditation. I remember a few years ago, we were running a group for my clients who hail from the lower socioeconomic strata. And when we were talking about meditation, they were actually saying that meditation is for wealthy people. And when I asked them why, they said, well, you require a special room, you require special lighting, you require a very quiet room. And unfortunately, many people don't have that luxury. Then we came up that, in fact, why can't we make the meditation very practical, whereby the, the basic definition of mindfulness is trying to pay an attention to a particular activity at that point in time and quite deliberately so. And by doing that, people slowly started to realize that they can build up on these activities and then create the gaps in their mind. And we know that at 15 to 20 minutes of these activities will actually show the benefits at a higher level. There has been a research from the York University which actually shows that the increase in the hippocampal area of the brain, which is the seat of basic positive emotions, can be shown on an fMRI scans. There are other simple techniques, including 4-7-8 breathing technique or 5-finger exercise. You just need to log in into the any website and will give you a very good idea about what it means. But basically, 4-7-8 breathing exercise is a basic yogic technique. And Dr. Andrew Weil in the United States has made it more popular. And then very good videos being shared by him to allow people to de-stress and go into a better coping mechanism. The WHO Academy has put up a very good slides and very visual slide to capture some of the points that I was mentioning. And I'll not go through the whole list, but in general, it is important to realize that gratitude per se, meaning not just saying thank you for the sake of saying, but trying to help people in terms of truly feeling a sense of gratitude. And that has known to be a psychological immunity booster and has been shown up in many researches even conducted very recently. And I think it'll be a good idea for us to be truly thankful to what we have rather than complaining about what we don't have. Okay, so we have done that. What about people who plan these services? I think we know that the COVID cases are identified and sometimes even treated by the personnel with a minimal training or, in fact, no training in mental health at all. And that's why it will be very important that for the planners, for the assessment and intervention of psychological concerns be geared to this group of people. And they will need to address it at an organizational level, whereby education and training regarding psychological issues should be provided to healthcare leaders, first responders, and emergency staff. And I think the planners will have to ensure that there is a seamless liaison between medical resources in the community, in the hospital, or what resource is available at an internet or at a web-based level. The there was a, we all know that Italy was very badly affected, and the wave that came in was very sudden. There has been very good articles which has not been yet peer reviewed, but one of the main thing that they have identified is the first point. The mental health research has shown that identifying, developing, and disseminating evidence-based resources related to this disaster, by meaning that providing an accurate information that people can trust, was one of the main points that help people's mental health. And that's why one will need to identify those vulnerable populations. So then we can come up with an important area in terms of how we can liaise with other professionals. So we can quickly triage these patients and refer them for extra help. And I think the other important issue that has been noticed is that most of the time, the death notification is being given by the nurses or personal support workers. And as we have seen in many countries, that those people who are dying due to the virus were dying alone, and their loved ones were not allowed to go and visit them. And at that time, the majority of the burden is being carried by the nurses or the frontline workers. And I believe that they are the people who are showing signs of burning out. And I think it is important that we provide the help to this group of population to prevent any further burnout and developing unnecessary future frank psychiatric problems. I think the planners will have to anticipate the changing needs because still this is very uncertain. And that's why I think we need to prepare the planners to anticipate the changing needs. Okay, we identify the group of population. We know what simple measures to be taken. What about the role of professionals? Because I here try and advise the family physician in terms of what to do, what to expect. And I have told them that even people who are coming forward to you for help for their routine issues, I think it is very important that you don't shy away from asking leading questions about COVID-related anxiety and distress. Because many times people are embarrassed and they are not volunteering their anxiety. And I think it is important to normalize certain reactions, to let them know that it's okay to be angry within reason. It's okay to feel anxious within reason. And I think point to the commonality that not only we are in the same boat, but in a way we are all in the same storm and continue to provide accurate information about community resources. Because there are resources out there are help out there, but unfortunately, not proper information has been given, and they rely on their family doctors to provide that information. I also advise them that we need to continue to reinforce the need for basic care, including sleep, nourishment, and showing that sense of gratitude. And I would briefly touch on role of medication. I I do know that although this is a complete new situation that we are all facing, the medications that we have to treat the anxiety, to treat the depression, to treat the psychosis, to treat the mania, are all very effective even at this time. And I think it is important to make a judicious use of these medications. I have seen that many physicians actually shy away from the use of benzodiazepines, for example. And I educate them that a proper and a judicious use of benzodiazepine at this point in time actually is extremely useful. I'll briefly talk about role of cannabis, which is very dear to me, and I know that many countries may not have get this legalized, but we have found that by using a particular strain of cannabis has not only helped people to deal with the current situation, but also allow them to develop the true level of acceptance, which I believe has prevented unnecessary use of many different medications. In summary, what's going to help us? I do believe that adaptability may be our best friend, not only during this COVID period, but even post-COVID period. And Washington Post recently highlighted what adaptability is all about. I think in general, there is a beautiful symbol of water comparing with adaptability. And I'm pretty sure that if you bring and picturize water, you will know what I mean when I say adaptability. In fact, people who are interested, just last weekend, the Spot Network released a video about Bruce Lee called Be Water. It's a documentary, which really gives you an idea what adaptability is all about. But in general, the adaptable people that they experiment. They see opportunity where other people see failures. And most importantly, they ask for help. And I do believe that the most important reason is that adaptable people do not complain, they do not whine. And I believe that not only in terms of mental health, but generally speaking, people will need this particular quality to let them go through the next stage. And once again, I thank you to provide me with this opportunity. I wish all of you a good health. So be safe, be happy, and be healthy. Thank you.